Hi everyone, welcome to N215's micro lecture on nursing process. What you want to do is have that 92-year-old case, the PDF case in your hand. Hopefully you've reviewed it. So let's kind of go through this case and work the nursing process. Okay, so you have this case out. We basically have a 92-year-old that's come to the hospital. He's got a long past medical history. He has coronary artery disease and he had a bypass. He has a heart failure, paroxysmal atrial fibrillation, hypertension, and also his surgical history of note is a left nephrectomy for renal cell carcinoma. So this gentleman has one kidney. Okay guys, so what are you thinking? What are your concerns? Well, first of all, don't forget about little things like the social history. He's recently widowed. He does live alone. And so that's contributing to his discharge plan of following up with care. And the nurse has to take that into consideration. But what are our real concerns? We are concerned about this right lower lobe pneumonia. So what's so concerning about this right lower lobe pneumonia? Well, first of all, it can cause oxygen deprivation. It can cause a clogged airway with thick mucus. You probably already know that, but let's talk nursing terms. Nursing terms. We're going to get into the nursing process and some nursing diagnoses. Most of you have already finished up with chapters 1, 2, and 3, and you're already on your way to chapter 7 and 8, nursing process, assessment, diagnosis, and planning. So this is a great little case to go over A.D.P.I.E. Okay, so what pre-existing conditions exist? We went over them already. This is a heart patient. He has a history of bypass, coronary artery disease. He was hospitalized once for diastolic heart failure. He has a history of paroxysmal atrial fib and a history of hypertension. This right lower lobe pneumonia can influence oxygenation and perfusion by worsening his cardiac condition. It can exacerbate his heart failure. The pneumonia can deprive the heart of oxygen, subsequently causing worsening heart failure and/or irritating the electrical conduction system and activating the paroxysmal atrial fib in this guy. You've got to think like that. When you're a registered nurse, you got to take in the whole past medical history into account when caring for somebody. So we're concerned about the heart failure, AFib, CAD, hypertension. We're going to have to give him his medications that he's normally on and administer those medications. One thing we're really concerned about is his history of a nephrectomy. He has one kidney and he already has chronic renal insufficiency. How is that going to affect this patient? Well, first of all, if you note, what's the treatment plan? IV Rocephin plus Zithromax. That's a combination of antibiotics. Antibiotics are also filtrated through the kidneys, so we have to trend our creatinine. We don't want to worsen this. So by now you already know about Maslow's hierarchy of needs. You've done your reading. You covered chapter 1, 2, and 3, and you've already uploaded your study guides. Now we're just continuing on with application of what you've learned, and you learned about Maslow's hierarchy of care, and that's what we're doing here. In nursing and in nursing school, they want you to identify problems in a care plan that cover mostly the physiological issues. So when you're working with a patient and you're coming up with a care plan and you're coming up with those problems, you're going to address things like breathing, food, water, elimination, sleep, way before you address safety, love and belonging, self-esteem, and self-actualization. Maslow is a psychologist, and he is one of the templates we use in our theory here at Cerritos College to allow our students to practice hierarchy of care. So when you do a care plan, you always number your care plan problems. Number 1, most important, followed by number 2. So by now you're already getting it. The number 1 problem has to do with airway in this patient. So we know this is an airway problem. It falls in the physiological. The physiological part of Maslow's contains many areas of the body like airway, elimination, neurological, mobility, nutrition. It's important that you get a care plan book even if you just check one out at the library. Or maybe you're going to go on Amazon and get a cheap old one. Or maybe you're going to go to a loaner site or an ebook. A nursing care plan book will help you identify key nursing interventions and goals for the problems that you come up with. Now we have a list of NANDA's, North American Nursing Diagnoses, that our program uses, and those are loaded up on Canvas as well. It's just a long list of nursing diagnoses that we tend to use in the program and our students use and are commonly found in nursing care plan books. Things like gas exchange, ineffective airway clearance, altered perfusion of the heart, nutrition imbalance, things like that. These terms you are familiar with as an LVN, you learned in LVN school. So, once again, we're going over some things you just learned in the book. We're on the assessment phase. Assessment phase has to do with subjective and objective data that you gather that backs up your problem. So what is our problem? We've chosen the nursing diagnosis impaired gas exchange. Why did we choose that? The patient has subjective and objective data that back up an airway problem. We chose the gas exchange primarily because, number 1, it's the number 1 hierarchy on the physiological plane of Maslow's hierarchy. But not just that. He has other little problems you could probably come up with, but that is our number 1 problem. And we know he's sitting only 93% at rest, which is honestly, truthfully, not too bad for a 92-year-old. Most of us sat 95 and above. He does have fine rails bilaterally and a right lower lobe pneumonia. So gas exchange is the proper nursing diagnosis. Okay, it's time for some goals. Planning has to do with making goals. You looked at your subjective and objective data. You came up with the problem. You identified it. Now it's time to plan. Just like that picture on the slide. You want to shoot for the stars. Plan great goals. I'll tell you, once I joined Weight Watchers one year, and I went to my first Weight Watcher meeting. And the lady said, "Patty, what is your goal for joining Weight Watchers?" And I said, "Well, I want to lose weight." And she goes, "Well, let's make a goal." She goes, "Well, what's your goal?" I said, "Well, I'd like to lose 10 pounds. She goes, "That's not a very good goal." She said, "You should make a goal that you can achieve. There has to be a time frame in there. It has to be measurable." I said, "Oh, I get it, kind of like nursing school." So I said, "I'd like to lose 10 pounds within 6 weeks." And she said, "That's great. I'm going to write that down in your book." So even Weight Watchers has goals. So goals are short-term or long-term. Here's some examples here for this patient with this impaired gas exchange. Most of your goals have to be time framed and measurable. So you'll notice the first short-term goal, patient saturation will improve to greater than 95% on oxygen within 1 hour. What is our time frame? 1 hour. How can we measure it? It's very easy. We check a pulse ox. If it's greater than 95, we've met our goal. The same goes for the long-term goal. Will the lung sounds be clear? When? What is the time frame? Within 3 days. These are important when you do your care plans. You want interventions that are applicable to goals as well, but first of all, you want to make good goals that are measurable and time framed. Well, what do you think of these interventions? I think they're pretty great. They're very applicable. The gentleman is going to get oxygen. Checking pulse oxes, RT or a nurse can do, either hourly or continuously, to evaluate if the oxygen levels are going up. The doctor ordered ABGs, arterial blood gases. These will evaluate both oxygenation and acid-base balance. Will tell us what his carbon dioxide is. It will give us information that help guide treatment. Administering antibiotics daily and calling for breathing treatments every 4 hours and auscultating lungs for wheezes or bronchi Q-shift. All great interventions for gas exchange. Well, let's evaluate this. So we're at the E, A.D.P.I.E. We went through A.D.P.I.E. We went through our assessment. We came up with a nursing diagnosis, impaired gas exchange. We planned and made a goal. We did a short-term goal and a long-term goal. We had great interventions on the last slide that would help us achieve that goal. Now it's time to evaluate the patient. When you're in the hospital in our program, you'll get to see real-world evaluations. When you're using these cases in my course, of course you cannot evaluate a patient, a fake patient. Most of these cases are real world. But I did have to build in the subjective and objective into the med-surg cases. So obviously you're not caring for this patient, so you won't have to do a E part of the care plan, which is the evaluation. There's no way to do it. But if we were to practice it, this is what it would look like. Well, that was a nice, easy peasy micro lecture on nursing process and A.D.P.I.E. We had a real case, a 92-year-old admitted for the hospital with a right lower lobe pneumonia. We had some physical examination and system review data on our case. We had some past medical history. We had some laboratory and x-ray data, not much. We had the chest x-ray, and we had the doctor's impression and plan. Now, with every case that you come in contact with in nursing school, you're always going to have the plan. That's the medical plan. The doctor orders breathing treatments. The doctor orders antibiotics. The doctor orders blood gases. But the nursing care plan is an actual plan of care that the nurse plans. JCAHO requires it of all hospitalized patients. Nursing care plans have to do with nursing care, so most of your interventions come from a nursing care plan book. So a book is not required. I usually loan them out prior to COVID. We do have some in the skills lab, but I'm not sure you could actually take them now. I'm sorry. The best thing for you to do is to go online and get an easy peasy, cheapo, discounted ebook, or call our librarian. There's 10 nursing care plan books available for checkout. How do you go about that? You go to the library and you can check it out. The library is open. There's also an online ebook through the library, and you can talk to them and figure it out. But to do your care plans, you have 2 mini care plans. The first one is due week 3. It's due by Saturday at 6 p.m. and you're going to be doing a care plan on a 67-year-old with a cough, shortness of breath, and a UTI. You're going to review that case, and you're also going to download and look at the subjective and objective data I made up to go with that case, and you're going to formulate your care plan. So I hope this helped you in utilizing the nursing process. Have a great day.